जय हिंद। आज हम डिस्कस करेंगे एक टॉपिक के बारे में जिसका नाम है इम्यूनाइजेशन शेड्यूल, गवर्नमेंट ऑफ इंडिया के द्वारा दिया हुआ। सो हियर विल डिस्कस अबाउट द doses and the timings. So the trick is BOH, DOH, MA, MOG, D, DTT. Here BOH stands for, BOH देखेंगे, BOH stands for, B है baboons and oxen of Houston and Detroit, owls, that is baboons and oxen of Houston and the Detroit owls, they are better hunters. And for DOH and BOH we have completed. So the next is MA and MOJDI. So for this MA we have mongoose and alligators of Miami and Ontario, they die early. We are done till DI. The next is DTT. For here we have dinosaurs and turkey are good as Tumbad. So dinosaurs and turkey are as good as Tumbad. The next thing that we are going to discuss is the doses. So at 0 dose, that is BOH, baboons and oxen of Houston, we have B. B stands for BCG here, 0 dose, that is the first dose or birth dose. And for O, O stands for oral polio vaccine. We also have D. DOH, we have to write 1, 2, 3. 3 times DOH. So DOH stands for, first DOH is again DPT at 6 weeks, then 10 weeks and 14 weeks. So the first 6 week is DOH. D stands for DPT vaccine. Then the next O stands for oral polio vaccine, the second dose. And we also have H. H is hepatitis B, the second dose. First dose was given at birth. Now the next 10 weeks, D again stands for DPT. O here stands for oral polio vaccine. It's the third dose for oral polio vaccine. And H, hepatitis B, it is the third dose again. Now DOH at 14 weeks. At 14 weeks we'll repeat. So for diphtheria it will now be the third dose. For oral polio vaccine it will be the fourth dose because the first one started at birth. For hepatitis it will be the fourth dose again at 14 weeks. We are done. Now for MA, mongoose and alligators of Miami. So mongoose, for M, it's the measles, the very first dose for measles at 9 months. This might be a question. Then A stands for alligators as such here. Moving on to the next dose. Again M, this is at 16 to 24 months. M here stands for measles, the second dose of measles. O is oral polio vaccine. What should be the dose? The dose should be the fifth dose. It's the fifth dose. And J is Japanese encephalitis, the very first dose. And D is for diphtheria, it's the fourth dose. Okay. Then the next D stands for diphtheria at age 5 to 6 years, and then T and T for we have to add 5 more years, it's 10, and then again 5 more years, 16, 15 to 16. So the T stands for tetanus toxoid at age 10, and again tetanus toxoid at age 15 to 16 years of age. We are done.